estimated 6 to 9 million people suffer from the painful spinal condition called scoliosis. Today, a local doctor explaining what causes this and the best pain management for it. With more on this, it's North Shore Dr. Chad Domingue, a neurologist with the Avala Physician Network and a pain management expert. Thanks for joining us, Doc, as we usually do weekly. Appreciate it.
Absolutely. Good afternoon to everybody. This is a personal subject to me. My mother actually has a rod in her back. She had a 65-degree angle in her spine growing up as a child.
And a lot of people, as you said, 6 to 9 million. So what exactly is scoliosis?
Yeah, so scoliosis is a curvature of the spine, an abnormal curvature. I'll give you another statistic, which surprised me doing this research. Adults over 25 is like 8% of the population, but above 65, it's 70% of the population. I was shocked by that statistic. And when we talk about curvature, most people think it's a side-to-side issue, but my mother was an example of this. It was a corkscrew type issue. So she had a very rotated, abnormal appearance to her spine. Why do people get this? We don't know. 80% of people that get scoliosis have what's called idiopathic, meaning no known cause. Another cause, which is a much smaller cause, are people with neurologic problems, so cerebral palsy, spina bifida, so their abnormal nervous system causes the spine to twist. And then you can also have it for these patients I was talking earlier from degeneration. You know, we have a very blue-collar state. Obesity, smoking, dries up these structures, causes the spine to degrade and causes it to bend and twist. What's interesting about scoliosis, no one knows, 8 more times more common in female. No reason why. We don't know. Obviously, hormonal related, don't know why. But it's very commonly occurring in children. We always have these kids get checked at school, feel their spines, because you want to catch this stuff early before the spine gets too twisted and bad things start to happen.
So what are some of the symptoms that it causes? What is a person who has scoliosis walking, sitting, feeling?
Yeah, so I remember in elementary school actually being tested, bending over and having someone check my spine. But, you know, these are kids that look abnormal, right? They kind of have a twisting, one hip's higher than the other, their shoulder blades may have a malformation. And what these people normally experience is back pain because of the misalignment. But it's much more than that, Liz. If the curve gets really bad, they can actually impinge their lungs. So the diaphragm doesn't have the ability to move, so they can have breathing problems. They can have gait problems. And I love the analogy to the alignment in a car. When your spine alignment's off, your tires, your shocks, everything wears out, right? So when your spine's off, hip problems, knee problems, ankle problems, these are people with multiple orthopedic issues.
So what are the treatments, especially if you can be dealing with a child as young as 10? What are the treatments for this?
So early detection is important, you know, and please, just from a society standpoint, don't go to these people and talk to them about their posture. It's you know, they get told this all the time. It's not their fault. They're not doing this on purpose. But you want to identify it early, because not always can you prevent the progression, but you want to prevent the spine problem from causing other issues. So you can brace kids if they have a curve around 20 to 40 degrees. If it's under 20 degrees, you don't touch it. When it gets above 40 degrees, then you're talking surgery. And when you're talking surgery, you're talking about fusing the spine. You're talking about screws being placed into the spine to keep the mobility. And that may be good in terms of keeping it straight, but you lose all that rotational mobility of your spine. So these people are predisposed to back problems. I see these people all the time. These are people that require procedures called rhizotomies, where I burn nerves in their back so they don't feel the arthritic pain. They can have pinched nerves in their spine because of the spine coming over, so epidural injections. But there's a whole host of things, but it's really important for parents, the patients, to really take hold of this disease and really understand before they commit to surgery, especially, what exactly are they getting surgery for, because there's a huge price to be paid. My mom is an example of that when you fuse your spine.
Okay, and is there anything you can do to prevent it?
So, you know, good health, right? Pilates, yoga, core strengthening, do not smoke. It's terrible for your spine. You know, obviously monitor your mechanics. You know, my father was terrible at this growing up. Use your legs, not your back when you're lifting.
Right.
You know, look at it almost like a diabetic, right? You've got to take hold of this disease process, one spine.
Thank you so much, Dr. Domingue. Appreciate it. The topic, scoliosis, what it is and how to treat it. Appreciate it. Have a great day.
Absolutely. Always a pleasure. Love your mind, love your spine. See you next week.